That's a really good question. The vast majority of the neck pain is actually benign, caused by benign medical conditions. In really less than 1% of the patients will need surgical intervention or some kind of pain intervention for dealing with their medical problem. And clinical examination, clinical history, and the imaging will make the decision what if the patient needs any kind of surgical intervention. And with a good discussion and a joint, I would say, understanding the pathology and the natural history of the disease, that will guide us toward a surgical intervention if needed. Doctors will spend the time with a good clinical history, which is the cornerstone for any kind of medical diagnosis, to understand what is the clinical problem. After that, they will do the clinical assessment in the way of the neurological examination and organize adequate imaging investigations, such as an MRI, X-rays, or a CT of the cervical spine, to guide us to pick up what type of the surgery is needed in your case. There are many treatments before we even consider the surgical intervention for the neck pain. The cornerstone is the physiotherapy, actively exercising by the patient, maybe some osteopathy, acupuncture, through the multidisciplinary team approach for treating the patients with a discomfort in the neck. And if nothing yields successful results, then we will consider possible pain injection, which can be done CT guided or X-ray guided. And the last option will be the surgery if needed. The most commonly is anterior cervical discectomy or cervical disc replacements if the problem is within the disc. If the problem is because the cord is compressed, then we may need to go from posterior approaches, which will do the disc decompressions with and without the instrumentations if needed. I always start with the therapy before the surgery because it's quite important that the patient understand that he can be treated successfully with the therapy on its own and with regular exercise. And then if the surgery has been indicated and that performed, then the patient may need some physiotherapy input afterwards, usually after several weeks when the discomfort settles down and the patient becomes to his previous normal medical condition. Then the physiotherapy input will be quite valuable, and then the patients will gradually in stepwise fashion increase their physical activity afterwards under the careful eye of the physiotherapist.